all we do on this platform is to bring you seasoned professionals in the health sector that help demystify every myth and bring you the factual and accessible treatment and management from beyond your doorstep. That's why we are here. Welcome to Your Health. And today I have Dr. Oko Enyu. He is a consultant plastic and reconstructive surgeon, Federal Medical Center here in Asaba. Dr. Oko, welcome to our platform.
Good day, madam. Good day, everyone.
Yeah. Okay. So now, Dr. Oko, as the name says, is designated a consultant, a plastic and reconstructive surgeon, deals with a lot of skin diseases, burns, and everything that has to do with you reconstructing your skin. That is, if there is a damage, he's here to save the situation. All right, and today we'll be looking at skin cancer. What do you know about skin cancer? Have you seen someone experiencing one, or does skin cancer look to you like the onset of a rash? This and more you will find out on our platform only if you stay, because we've got you the best. Okay, Dr. Ko, skin cancer, what is it all about?
Thank you very much for that question. First of all, let's just know what cancers represent. Or delving subsequently into skin cancers.
Yes.
Cancers actually are, to the scientific and general population, they are abnormal growth of cells that make up the body, tissues and organs. It can affect any organ of the body, because in each organ there are a number of cells that make up such an organ. So likewise, the skin, being an organ, has a number of cells in it that actually could pose the challenge of abnormal growth, in that they actually obviate the control of the normal growth signals, and they behave in a way that does not maintain balance in the living tissue. That's essentially what skin cancers refer to.
Okay, so now you know, if you're just joining us, Dr. Oko has just told us the definition of cancer as an overview and generally what the skin cancer is all about. Now, many persons will be saying cancer is a silent killer. It usually is not so asymptomatic, or it's not so painful. But now, what generally would you say is the most prevalent cause of cancer?
Well, in general, cancers actually, they have no known causes. However, what we discuss in cancer, carcinogenesis, is actually 2 or 3 pronged. So you have risk factors that comes from genetic predisposition to phenotypic characteristics of the individuals, as well as the environmental factors. So all these 3 composite factors contribute to causing the concept of skin cancers. For the skin itself, there are some persons are known to have problems with DNA repair mechanisms, such as individuals with xeroderma pigmentosa. Then some also have other genetic lacks, like people with albinism that have problems with melanin, which actually is one of the component cells that lead to the development of one of the most deadly kind of skin cancers that we'll be talking about subsequently. Then the environment where we stay, what we interact with, a lot of chemicals ranging from household chemicals that we could use in control of pets, insects and all that. Those could actually pose
like our commonly used insecticides?
Exactly. Then also, in addition to that, the most common one is the sun rays, what we refer to as the ultraviolet radiation.
Sorry, like staying out in the sun?
Exactly. So the sun, even if it's beneficial, also has some harmful effects, one of which is the problem of skin cancer development.
Okay.
And also there are other social factors that also contribute to one developing skin cancer, such as smoking.
Smoking.
Yes, it's been found that smokers are most likely prone to developing some specific type of skin cancers,
Okay, this time not the lung cancer.
No, they have skin cancers, especially squamous cell carcinomas that affect predominantly the lip in smokers. Also, alcohol has also been found to be another significant risk factor in causing cancer development.
Okay, now we know that if you smoke, you're not just liable to die young like the producer will print out on the pack of the cigarette or any other consumable that you inhale, and especially they come out as a smoke. You also drink, especially the consumption of alcohol. Is it little or just excessively?
Well, the person that
because some person will tell you, I take alcohol for a little for the stomach's sake.
Yeah, the question that usually comes up is how little is little,
okay,
and how big is big. So
okay,
these things are relative terms.
Okay, so now you know that it's not about just the quantity, that even a little alcohol could actually make you cancerous depending on your DNA composition. Okay, and also know that people with albino, that the albino skin person are very like Nigeria Igbo, as we refer to them, are also susceptible to skin cancer. Okay, because of those patches you see on them.
Yes, those patches actually are signals that some problems have started developing. Ideally, there shouldn't be any skin patch if they were aware of what they were at risk of developing. So when we, as we proceed, I will get to talk about things that they could actually do, specifically for albinos. In general, every human being, as long as you have skin covering your body,
you can actually develop a skin cancer.
Exactly.
Okay, so now let's look at now, for the albinos, we understand now that the patch is an onset that you're developing the skin cancer. Then for every other person, like me, I'm not albino now, and some persons are also dark-skinned. You're not that light, I'm not that light. And for the persons who are dark, yet we've also heard of dark persons who have cancer, but they don't know. So what are these common symptoms that one could look at and say, this could be an onset of cancer on my skin?
Thank you very much. The symptoms of skin cancers are actually varied depending on the type of skin cancer, but basically we actually group them into
primary. In other ways, there are types of skin cancer.
Exactly.
Okay. So let's just take that together.
Okay, so I should take the symptoms first or the types? Which one?
Anyone, just please.
So let's just classify the types of skin cancer. Okay. Basically, when we refer to skin cancers, we usually group them basically into two. However, there are other types. Okay. Like I was trying to talk about the risk factors. The list I gave is actually not exhaustive. But basically, when you classify skin cancers, you divide them into the melanoma skin cancers and the non-melanoma skin cancers. These are the two basic categorization. Then under the melanoma skin cancer is what we actually call melanoma. Then for the non-melanoma skin cancers, we have the basal cell carcinoma as well as the squamous cell carcinoma. Then there are other subtypes of skin cancer depending on what is the predisposing factor. For instance, in patients who have immunosuppression of any form, such as seen in people that have had organ transplantation. Okay, because of the fact that when you have an organ transplant, you are on prolonged or lifelong immunosuppressive therapy. So that suppresses the immune system, and usually the skin actually serves as a barrier function in terms of immunological surveillance through some cells we call the antigen presenting cells. But when there's immunosuppression, these cells actually are reduced in both function and number, so they are not able to do the surveillance property which they are actually meant for. So those particular kind of patients are actually prone to developing
skin
cancer such as Kaposi sarcoma, especially seen in patients with acquired immunodeficiency syndrome, HIV, AIDS, and other organ transplantation. There are other subtypes of cancer of the skin, such as Merkel cell carcinoma and the rest. But basically, what do we?
This medical terminology is actually driving me crazy. But are there common names that we know them as?
Yes.
Can we just use that one for the sake of my audience?
Well, when you talk about common names, we'll just say skin cancer as common name.
Oh, okay.
But really why it's important for people to know is that in as much as all of them are skin cancers, they do not have the same treatment modality. Okay, their treatment modality varies depending on the subtype. So, but for the audience, it's actually good they hear these terms, and perhaps they could actually do some research on it and know more. But at least it's actually important for them to know that skin cancer doesn't mean it's just one.
Okay.
There are 100 and something subtypes of skin cancers. You know.
Really?
Yes, but for the purpose of public enlightenment, I've tried to just subgroup it into two. So that, but skin cancers are not broadly the same. So you cannot actually. And
so the treatments are not
varied. But there are basic principles that guide treatment. When we get further in the discussion, we'll discuss it. So back to the symptoms. When we discuss symptoms, there are those things that you see and you begin to think, could this patient have a skin cancer or not? So we actually classify them as professionals into primary skin lesions and secondary skin lesions. And just to add, that skin cancers could also be primary. That means it's coming from the skin, ab initio. It could also be secondary. That means it's coming from another cancer in another part of the body.
Okay, another cancer.
From another part of the body. That's secondary skin cancer. As different from the skin lesions, which depicts how they actually present. That's the symptom of this skin cancer. So some of the basic ones in the layman's view are usually skin growth. Then skin changes such as rashes. Those are things that will herald. Then those skin growth, there are other things that may be associated with them, such as pain, itchiness, and ulceration. So by the time you start seeing all those things, it tells you that something else is actually going on. Then some people actually are born with some skin growth, what we call birthmarks. In the medical term, we call them nevus. We call them benign nevus. That means they do not actually cause cancer, but over time, they could actually have the potential. That means they can transform into those cancers. If some other things actually happen to them, and also if they have a positive family history of skin cancer.
Can cancer be detected early?
Yes. Cancers can be detected early. In fact, the best time to manage cancer is actually at the early stage. At that stage, simple surgical treatment can offer a cure, just like any other solid tumor in any other part of the body. Early diagnosis, early treatment, high potential for cure. As against when they present it, it's difficult to actually achieve a cure. What you'll be talking about is
managing.
Exactly. So those are the
So early detection is always the first point.
That's the key.
So when we say we don't start the do-it-yourself treatment at home,
that is an absolute no.
No.
Please, you must not do self-medication on skin lesions.
Because oftentimes in our clients, is it not just a rash? I go to over-the-counter pharmacy, buy any of the tubes, the steroid tubes, and begin to apply. Then instead of healing, it begins to turn reddish, begin to spread, and then I present her this. I'm almost late. That
time is already moving farther than it should have been. But if one is lucky, one can actually detect it earlier again at that time. Maybe it may not have advanced so much. But what I say is that once you notice something that was not there before in your skin, or something that was there, like the birthmarks, people commonly all those moles, for the layman, moles, that's nevus. You see them, and all of a sudden, ab initio, it was small. Then subsequently you start seeing it becoming bigger. You should actually see your doctor. Then initially it was all uniformly colored, like if the patient is dark, the whole thing is dark. Then later you start seeing some areas becoming a little bit less dark than the other part. Then there's a problem. So there's already what we call variegate coloration. Then you look at the surface. Ab initio, it was smooth. Then subsequently it begins to change into a rough kind of surface. You should actually worry. Then if you're noticing that the number is actually increasing, it was one before, but now you're seeing more, you should worry. It should be a cause for worry for the individual that has it. And once you start seeing those things, you should actually seek the medical
attention. Okay, if you're just joining us, is the program Your Health, and we're looking today at skin cancer. I have a consultant, plastic and reconstructive surgeon in the house, Dr. Oko NU of the Federal Medical Center in the house, and he said a lot that if you are drinking, especially consuming alcohol, smoking, and you also happen to be you have the skin type albino, you're also actually predisposing yourself to skin cancer. Especially if you're an albino, you should know that the sun is not really your friend. Okay, now we've also looked at the symptoms, the primary and secondary, but you know what, we'll take a break now. When we'll come back, Dr. Oko will still be very much in the house to throw more light on skin cancer. Good to have you back on our platform. Is the fastest platform on your dial, and it's Your Health, a program that brings health management beyond the step, thus making accessible and manageable treatment and of course knowledge of every medical situation that you have. Skin cancer is a topic of discuss today, and I have Dr. Oko in the house. He is a consultant plastic and reconstructive surgeon from the Federal Medical Center here in Asaba. And of course, at this point, I want to say big thank you to the Nigerian Medical Association Asaba Zone for loading us such an erudite professional today. Okay, Dr. Oko, before we went on break, we've looked at the definition, symptoms, types, and now is skin cancer painful?
Thank you for the question. Pain is actually one of the, it could actually, a skin cancer could be painful, and I think that it could be painless. Now, at the initial stage, when it's developing, it might overtly be painless. And that's actually why most of the time, the patients that have these lesions that are started transforming would not present, because usually, unless something is causing you discomfort, you don't bother about it. That's the problem with
so let it go, it will heal.
Exactly. But when they start causing pain, some of that will start occurring. For instance, there's something called neural invasion. Okay, that means it has actually left the original area of development and started involving the nerves around that particular growth. And once it has happened, it's already spread as against when it's painless. But that time when it's painless, people, unless you're the type that actually takes extra look at yourself, you might not be bothered about it. Yes, you might not be bothered about it, but something is already going on. So it's only when pain comes, and by that time it may have actually gone beyond. Exactly. So it could either be painless, and also it could be painful. So pain is a symptom of cancer.
Now let's start looking at ways of avoiding getting skin cancer. That is, now we're looking at prevention and as well as treatment if there be need, and probably how generally we manage our skins to avoid skin cancer.
Thank you very much for the question. In fact, prevention is better than cure. It's a common axiom in our locale.
Yeah.
It's not different from seeing skin cancers. In preventing skin cancers, there are a lot of things that actually come into play.
Okay.
First of all, the most important risk of developing skin cancer is actually the ultraviolet radiation. That is the sun rays. And usually there are different types of ultraviolet radiation. You have the A, the B, and the C. Luckily for us, the C doesn't actually get to the Earth's surface because of the effect of the ozone shielding it.
And it's dangerous.
Very, very, very dangerous.
Human activity is almost helping us to get there.
Very good. Thank you very much. So the ones that actually get to us with the stratosphere, it's not able to, or rather the ozone layer, it's not able to totally absorb.
Shield us from.
Totally. The UVB, which we get about 5 to 10% of it getting to us, and it's the most dangerous. Then, of course, we have the UVA that we have 90% getting to us. Okay, that's less dangerous, but also it's also carcinogenic. How do they potentiate cancer? These rays, they actually penetrate the skin layer, okay, and cause, for the UVA, they actually cause reduction in the antigen presenting cells. Those are the immune surveillance cells of the skin, and by so doing they induce inflammatory changes, so rendering the skin a little bit vulnerable to developing skin cancer.
Okay.
Then for the UVB, what it does is to damage the collagen and the elastin structure that make up the one of the deepest layer of the skin, which we call the reticular dermis.
That's why most of cosmetic productions will see the input of collagen and the last. Okay, now we're getting it.
So,
we're looking at the ways of preventing, we're staying away from the sun if possible of the house. Okay, so let's start from there.
So our economy, per se, doesn't actually allow you to stay indoors all day. But even as much as sun is actually harmful, it actually has some benefits. But that's not.
But I was about to ask about the vitamin Q.
Yeah, that's not for today's discussion. We are just focusing on skin cancer prevention. So there are things that could actually aid even in those exposures. Basically, it ranges from for instance, for females, use of makeups could actually be a shield from those ultraviolet radiation.
Okay.
Use of hats for men and also for women, protective clothing, that also sunglasses. Then for people that drive, the windscreen for the cars are also ways of actually protecting against this radiation. Then also, like I've earlier mentioned about smoking as well as alcohol, then all those immunosuppressive conditions.
Okay.
Reducing alcohol intake if possible, avoiding them is also important. Then avoiding smoking is also important. Then there are some conditions that I manage. For instance, burns. Patients that have had burns are more at risk of developing skin cancers. So usually for my patients, I usually give them extra advice. After the healing of the burns, you must protect from ultraviolet radiation, because the skin is not as it was prior to the burn injury. So you have to take extra caution, otherwise they are actually prone to developing skin cancers. Another one that's important, so these are the level of primary prevention. Then when you go over to secondary prevention, somebody that has developed a growth, okay, on the skin, or somebody has had a growth before from birth and notices some anomalies, some changes, should actually present to the healthcare facility for the patient to be examined. There are non-invasive tools for examining the skin that could actually help in saying
identifying there is a challenge.
Very good.
Okay, Dr. Lastly, before we go, is skin cancer curable if we are not able to prevent it? We get diagnosed. Is it curable? Because time is no longer.
The answer is actually a relative one, depending on the time when the diagnosis was made. If it was at the early stage, for instance, carcinoma in situ, or if early stage cancers are basically curable. But once it's late, spreading to other tissues and all that, what you'll be talking about will not be cure anymore, but you're talking about remission.
managing it?
Yes. Just
Just
say, okay, how many years of tumor-free life does the patient have and all that. So you can't be talking back at that stage. So at every time you have to actually continue follow-up. Some people can actually stay 10 years without having recurrence and all that. So you keep following them up. But those early stages, you do a simple excision, and with good margin, patient can actually have a cure. Once the histopathologist looks at the slide of the excised specimen and it tells you that the margins are free, apparently that patient has got a cure. But at the late stage, even when you take out the margin, because of the spread, you might not actually be talking about cure. So at that stage, you might actually combine, apart from surgery, other modalities, chemotherapy, immunotherapy.
Just like every other cancer.
Exactly, and even radiotherapy.
Okay, so now you know that skin cancer, like every other cancer, be it ovarian, be it the breast cancer, be it the lung, or even the prostate cancer, anything cancer is always not curable if it has gotten to the advanced stage, and the skin cancer is no exception. So all you need to do is, if you notice something is abnormal on your skin, then please present early, because early diagnosis and treatment is the only way you can get a near permanent cure for skin cancer. But if it's late, then smokers beware, alcohol intakers beware. Just stay out of the sun as possible as you can afford to. Until we meet again, I want to say thank you to Dr. KNU, consultant plastic and reconstructive surgeon, Federal Medical Center, Asaba, for coming. Thank you so much.
Thank you so very much, madam.
And also thank you to the Nigerian Medical Association Asaba Zone. On this note, I say thank you. Until we meet again, on behalf of the crew, salute. Take care of yourself and stay out of the sun.